Good evening and welcome to TPA Talks. Please welcome to the stage your host for the evening, Trish Michelle.
Thank you, thank you. Good evening, and thank you for joining us tonight at the Sheen Center for Thought and Culture. I'm thrilled to welcome you to the Pink Agenda's annual Health and Wellness Educational Symposium, TPA Talks. I'm Trish Michelle, and I will be your host for this empowering and informative evening. I, like many here tonight, was touched by breast cancer in my early adult life. I was diagnosed with invasive ductal carcinoma at 36 years old. No history, no nothing. I knew that I needed to put my health first and wanted to bring visibility to my journey so that others going through treatment would know that they were not alone. As an advocate, I worked tirelessly to raise awareness, provide representation, and am actively working towards creating an inclusive and progressive movement towards equity, particularly for those fighting cancer or other chronic illnesses. Through the power of social media and organizations like the Pink Agenda and the Breast Cancer Research Foundation, it's easier than ever to connect with people who understand what you're going through and who are just as passionate about making breast cancer history. The Pink Agenda's mission to engage tomorrow's generation to find tomorrow's cure truly resonates with me, as this important work is helping everyone with breast cancer to live longer, healthier lives. I am so honored to be here. Tonight, we are fortunate to have a diverse lineup of speakers to discuss the latest developments in breast cancer research, innovative approaches to improving quality of life during and after treatment, the effects of diet and physical activity interventions on a breast cancer diagnosis, and the benefits of breath work, and music for physical and mental health. We'll also hear from survivors and thrivers, each with their own important story. To get our program started, it is my pleasure to invite TPA Leadership Council member Kaylee Scott to the stage to introduce our first speaker. Thank you.
Thank you, Trish. She's my internet friend, and I'm so happy that we got to meet tonight. So I am honored and so thrilled to introduce our first speaker tonight, Dr. Elisa Port. I feel particularly sentimental about this moment. Dr. Port is my surgeon. Today is our one-year anniversary. It was a year ago today, April 13th, that I walked into her office 9 days after diagnosis for my first appointment with her. I was introduced to Dr. Port through a friend of mine, a fellow breast cancer survivor, who vehemently insisted. She said, "You don't have to choose my surgeon. I insist that you meet my surgeon." And the second she walked into the room, I knew that she would be my surgeon. I based it on recommendations and vibes, and Dr. Port had it all. And every step of the way, she has made me feel validated and extremely well cared for. Her attention to her patients, her warmth and transparency in our care has made this journey so much easier to grasp. One of my favorite memories was during my first follow-up after my mastectomy, and I was, sitting there nervously waiting for my surgical pathology, as probably many of us have been there. And she opened the door, and she was like holding it up like this, and she was like, "It's really good news," as she practically danced into the room. And that was, it was still cancer, but we take the wins where we can get them, and it was such a relief just to share in that moment of relief and excitement with her, knowing that we were in this together. So more about Dr. Port, the fabulous Dr. Port. She joined Mount Sinai Hospital and its Icahn School of Medicine in 2010, and she serves as Chief of Breast Surgery and Director of the Dubin Breast Center. She performs, yes, let's give it up. She performs hundreds of operations each year and is a leading expert in sentinel node biopsy, nipple-sparing mastectomy, as well as the use of breast MRI. Dr. Port is the author of the New Generation Breast Cancer book, How to Navigate Your Diagnosis and Treatment Options and Remain Optimistic in the Age of Information Overload. And her research has been widely published in numerous journals. Her BCRF-supported research is focused on the development of new strategies to prevent triple-negative breast cancers from progressing and metastasizing. Here tonight to present what's new in breast cancer, advances in screening, genetic testing, and treatment, please join me in giving a warm welcome to the doctor I'm absolutely obsessed with, Dr. Elisa Port.
Thank you so much. Wow. Thank you guys so much for coming, and thank you to Kaylee for the beautiful introduction. I am honored and privileged to walk into so many women's lives and to get to know them and really to get to love them. It's one of the greatest honors you can have to participate in someone's life in this way. So thank you for the introduction, and thanks to all of you for being here. I thought I would just talk a little bit about, I know this is a little bit like preaching to the choir because you all know how important all of this stuff is, but there's been a lot of new developments, and to me that's really important to talk about with great frequency. So just by way of background, probably everyone in this room knows, either personally or by association, breast cancer is the most common cancer to affect women in the United States, with an estimated 300,000 new cases estimated for 2023. Here's the crazy part: of women who are diagnosed with all cancers, 30% are going to be breast cancers. Okay, so that's a huge proportion of women diagnosed with any type of cancer. Obviously, men get breast cancer too, maybe not so obvious to some. It's very, very rare. It makes up about 1% of all breast cancer diagnoses and about 1% of all cancers in men, a total of about 3,000 cases a year. There are many reasons for optimism in the field of breast cancer, and I never get tired of talking about this. It's important to know that between 2000 and 2010, the mortality rate from breast cancer decreased by almost 2% each year. So that means if you were diagnosed in 2011, you were 20% more likely to survive than 10 years earlier. And so now for all breast cancer, the survival rate approaches 90%. And there's some types of breast cancers where we can even give someone a 98 or 99% likelihood of survival, which are extremely good odds in the cancer world and something that we look forward to extending to all patients with breast cancer. The main reasons that we've done so well over the last 20 years are two: better options for early detection and better treatment options. And the main thing is all of these treatment options and all of these early detection options means there's no one size fits all. We've moved way past a one size fits all approach. And that's something that I talk about a lot in my book, which is, you know, every single person who comes into my office with breast cancer says, I have this friend who had the, quote, exact same thing, or I had a neighbor, I had a relative, okay? What we know is no two cases are exactly the same. Even the same diagnosis is not the same. And so as a result of that, care has to be individualized, personalized, precise, and that's what we do now in 2023. One of the reasons I wrote my book is because in the ages of one size fits all, you could go to in the days before the internet, you could go to a friend and everybody would have the same thing, and that did apply. Once we moved into the area of personalized care and very, very many different treatment options, it became harder and harder to get information without seeing a doctor about your particular case. And so prior to seeing a doctor, patients were going to the internet, the obvious Google search, right? That coffee mug that you guys have seen. I don't have one, but I think it all the time. Please don't confuse your Google search with my MD degree. I'm sure you guys have heard of that. So anyway, not so funny, I guess. A lot of people Google the brains out of their diagnosis. And what I always say is that there are very few things a layperson can find on the internet about her personal diagnosis and any meaningful advice. And so all healthcare recommendations, particularly as it relates to breast cancer, have to be individualized, personalized in a center of excellence. And that applies to things beyond breast cancer as well. I want to talk a little bit about screening because this is one of my torches to bear about early detection and screening. And we've fallen off the grid a little bit as it relates to COVID, and there's a lot of room for improvement still here. Mammograms do save lives. They do, okay? It's proven, okay? Most cancers picked up by a mammogram are earlier and smaller, stage 1 or stage 2. Also in 2023, about 25% of all the breast cancers we detect are a kind of breast cancer called stage 0, DCIS. These are not invasive cancers. These are almost exclusively picked up by mammogram, and these are associated with that 98, 99% cure rate. And screening and different types of imaging is one of the areas where we've made the most progress. Mammogram technology has improved dramatically over the years. We've gone from screen, just film, normal film, to digital, to now 3D. And we're doing better than ever before. And of course, there's other types of imaging, ultrasound MRI, that can supplement. We'll talk a little bit about that. There is absolutely no questions that mammograms do save lives. The reduction in mortality is 15 to 30%, and it is across all age groups starting at age 40. So there should really be no controversy about getting mammograms and starting at age 40 and doing them yearly. It's seen across all age groups. What's really new is something that my group has worked on, is that there are other benefits of mammograms. What we did in our study at the Dubin Breast Center is we took every woman who walked in to our doors with breast cancer and divided them into 3 groups. The women who had had a mammogram within the last 2 years and who were pretty much up to date with their screening. The women who had had a mammogram before, but not for a while, longer than 2 years, maybe 5 years ago. And believe it or not, women who had never had a mammogram, okay? Yes, it's true in 2023. And if you compare the first group with the longer versus never group, the women who had undergone screening in the last 2 years were way less likely to require a mastectomy. Some choose it anyway, but way less likely to need the mastectomy to get rid of all the disease. Way less likely to require chemotherapy or have that recommended, and way less likely to need all their lymph nodes removed. So these are huge advances and benefits of screening. Who wouldn't want to cure their breast cancer with way less aggressive and invasive treatments? And we published this report in 2018. We got a lot of press at the time, but I still think the benefits of mammogram are undervalued and undersold. The question is why is there still controversy over mammograms? Because the reasons that mammograms are not recommended, or some of the national guidelines have changed, is mostly related to cost cutting and cost saving. And the sad part for me about this is that the lowest socioeconomic levels are the ones that will be hurt the most, and some of these women will get the most aggressive forms of breast cancer. You know, women who can afford it will always be able to afford a mammogram if they want. That's not okay. These tests save lives, and they have to be available to all people, regardless, all women, regardless of ability to pay. A lot of times, the guidelines prioritize harms of mammograms like anxiety and stress from being called back in to get additional pictures and, oh my God, what if there's something wrong? Well, what about the stress related to an advanced breast cancer diagnosis? I see that all the time. Trust me, it's far worse. It is important to know that most callbacks, if they say, wow, we think we see something, come back in, about 80% of those will be resolved with additional pictures, no biopsy needed. And now 3D mammography, which is really the new standard of care, we were the first ones in New York to get it at the Dubin Breast Center, decreases the callback rates by 20 or 30%. So our guidelines are really consistent. Start at age 40, earlier if you have a family history of young age at diagnosis. And yearly after that if you're at average risk. That's with no exceptional risk factors. Well, we know mammograms pick up about 85 to 90% of breast cancers, and they're the best we have. But 10 to 15% of breast cancers are mammographically occult. And so what do we do to close this gap and make sure we're not missing anything? The goal of additional imaging is always to pick up the additional cancers that mammograms miss. But obtaining additional tests, again, is not one size fits all. And it needs to be judicious and individualized and based on all kinds of risk factors like age, risk level, overall health, findings on physical examination. Is someone difficult to examine where you might not be able to find something, or are they easier to examine? And breast density, of course. This is just an example of how you can see the breast on the right is a very dense breast. The breast on the left is a less dense breast, and there's the cancer right there. And you can see how hard that would be to pick up against that background over there. So this is when we start talking about additional tests. Well, on March 9th, 2023, roughly a month ago, there was a legislation enacted by the FDA that all women must be notified of their breast density so that they can talk to their doctors about the value of maybe adding on additional tests like ultrasound. And here I am on March 10th talking about this on CNN, showing breast density and all of that. The other thing I wanted to briefly talk about is advances in genetic testing. There were 2 genes identified, which many of you are familiar with, BRCA1 and BRCA2, in 1994 and 95, and they're associated with the highest risks of getting breast cancer. These genes are associated with a 60 to 90% chance of getting breast cancer, a higher risk of ovarian cancer, pancreatic, prostate in men, and in men with the BRCA2, male breast cancer. The genetic mutation is present in about 1 in 500 in the general population, but closer to 1 in 40 or 2% in the Ashkenazi Jewish population, which is Jewish people from Eastern European and European descent. Any and all ethnic groups can have the BRCA gene. I've seen it in every background, but there are red flags for being tested. Again, Ashkenazi Jewish background. If you were diagnosed with breast cancer at a younger age, interestingly, this just changed. We used to test all people under the age of 45. Now we've moved it to 50, so casts a wider net for genetic testing. And also one has to be careful about family history of pancreatic cancers, melanomas, and other cancers. And here's what I wanted to talk about. Since 2013, there are other genes that have been identified also associated with breast cancer risk. PALB2, CHEK2, ATM, and many others. And these are also associated with higher risks of breast cancer. And in addition, the guidelines for testing have been expanded, and there's a lower cost for those even if you don't qualify. So the newest recommendations from our society is test everyone diagnosed with breast cancer. And why? What's the benefit? So even if you don't have breast cancer, we can identify the group at highest risk so we can screen them more effectively. We did a study in 2021 and showed that even in a full-service breast center, about 28% of those who met criteria for testing were not offered testing. And so we can do better with this. You have to ask about the mother and the father's side. A lot of people don't realize you can get the BRCA gene from the father's side. We have to be careful in people who have limited family histories. What if you're adopted and you don't know anything about your biologic family history? So there's tricky parts to that we have to be aware of. And in these women, we also do MRIs, and this is the exact same person, and you can see how that cancer on the right on MRI would be completely invisible on the left. And these are women at the highest risk of breast cancer for whom we add this. Well, why not MRI for everyone if it's so great? More is better, right? The answer is that MRI is also associated with a very high false positive rate. If you get an MRI, there's a 30% chance a biopsy would be recommended, a 20% chance you'll need a 6-month follow-up. And in the general risk population, it's really, really only associated with about a 1% risk of getting breast cancer. I love to show this picture. This is actually, of course, totally anonymized, but a pretty recognized person. One of the benefits of testing is, of course, you can screen people, but the flip side is we can also prevent breast cancer. And the way we do it is removing the tissue at risk. And as many of you know, the options for reconstruction have become incredibly aesthetically good. The top two pictures are before, the bottom two pictures are after. We save nipples, we make the incision underneath now often. And so we've opened up this door for actually preventing breast cancer in one of the highest risk groups. So, in conclusion, I ripped through this, but I think we got a lot of information out there. There is more room, I hope you feel, for optimism with breast cancer diagnosis and for prevention than ever before. There have been new developments in imaging. There's new developments in genetic testing. If anyone got genetic testing pre-2013 and tested negative, revisit that. There are many more things we can test for. And also therapies to optimize diagnosis and treatment. And again, we have moved way past a one-size-fits-all approach. For anyone newly diagnosed, getting to a top-tier cancer center, which we are so lucky in New York here to have so many, is really key. You know, I say to people travel and spend a lot of money to go to Disneyland and to come into the city for shows and do all kinds of things. Make your care a priority and go to the best that you can go to. Thank you for your attention. I appreciate it. Thanks for the opportunity.
Dr. Port, that was fascinating. Thank you. Our next speaker, Kathleen Booker, the Jedi of Calm, is a certified and insured breathwork coach and, to top it off, an effervescent native New Yorker. Kathleen is passionate about and has worked with many masters in the field of conscious connected breathwork therapy, knowing firsthand the energy, healing, peace, and joy it creates in one's life. For over 10 years, she has used her breath coaching and intuitive skills to support individuals, helping them identify the areas most in need of growth, healing, and focused goal creation in their lives. Her instinctive sense of what will motivate and empower her clients is the impetus for their transformation. Here to present soothing breathwork and provide a demonstration, please, everyone, give a warm welcome to Kathleen Booker.
Thank you, love. What's happening, what's happening, what's happening? Can we just take a breath and say, wow, Dr. Porter? I mean, is she all that and a can of Cheese Whiz? She's awesome. Come on, give it up, give it up. My name is Kathleen Booker, also known as the Jedi of Calm, also known as the Queen of Serene. And breath work is, there's so much that I can say about the breath. Breath is life. The breath, I'm unconventional. I'm just going to say that on top. Get your pen, get your phone, take my number because I'm not going to remember at the end. Take my email down, Kathleen@kathleenbooker.net. I'm not going to go into a lot about the breath because I want you to experience it. I want you to get it in your body. Take my email, reach out to me. I'm happy to have a conversation with you and give you more of the science, but I really want us to breathe. Kathleen@kathleenbooker.net. So the breath releases stress, it releases cortisol, that fight or flight, and when an individual receives the diagnosis, a host of emotions come with it. Open your mouth, take an inhale. Exhale and just say, ah. Good. Do that one more time. Open your mouth, take an inhale. And just let it go. So you are faced with a lot, you've got to focus, your emotions are up and down, you could be frozen, it's everything. The breath allows us to be aligned, grounded, focused, And from that point, be able to hear what's being spoken to us and make choices for ourselves that are for our highest and greatest good. The breath also lowers high blood pressure. It also enhances the immune system. It got you up this morning. So let's breathe. Place your feet flat on the ground. And I know this auditorium has comfy chairs, but take your arms off of the armrest. And I say that because it'll keep your shoulders in a stress position. And if you're willing, close your eyes. If you're not comfortable doing that, just look at the tip of your nose. And just allow your body to begin to relax. There's nothing you have to do. Your body wants to relax. And you may notice that your lower belly is a little softer. You may notice that your shoulders have just relaxed a moment. And I offer to all of you to give yourself the gift of this time. The breath that we're going to do is conscious connected breath work, connecting your inhale to your exhale through your inhale, and breathing through your nose. And there's no effort to the breath. The breath loves you so much, it's been rolling within you and through you all day. So just allow yourself to snuggle into your breath. Allow your breath to snuggle into you. Breathing through your nose, your inhale flows into your exhale. Your exhale flows into your inhale. And you feel your back shoulder blades of their own accord soften and roll down your back. Your inhale flows into your exhale. Your exhale flows into your inhale. And your lower belly just softens a little bit more. And if you yawn, that's fabulous, because that means that your body is relaxing. I'm not offended. As your inhale flows into your exhale, and your exhale flows into your inhale, breathing through your nose, feel a softening and a lengthening in your toes. As your toes soften and relax from walking around the New York City streets all day, there's a relaxation in the soles of your feet. And your inhale flows into your exhale. Your exhale flows into your inhale, and your ankles soften. Your calf muscles lengthen, relax. And if tears begin to fall, that's okay. Allow the tears to fall. That's a beautiful way to release energy that's not supporting you, and a beautiful way to heal. Your calf muscles relax, your knees soften, your left and right thigh relax. Your buttock muscles relax, and allow your anal sphincter to soften. If you expel gas, I'm A-okay with that. If you burp, I'm A-okay with that too. That's the body releasing. Your inhale flows into your exhale. Your exhale flows into your inhale, softening your pubic bone. And you don't have to think about, well, where's my pubic bone? No, your breath knows. Your intestines relax. All of the organs and systems in your body soften. Your shoulders again, just relax and staying with your breath and with your eyes closed, gently take your left hand and brush your right shoulder, releasing the schmutz from the day. Now take your right hand and brush your left shoulder and let it go. Stay with your breath. Let your hands rest back in your lap. Feeling your breath flow through your left arm past your fingertips, your right arm past your fingertips. Gently open your mouth, take a breath in. Exhale, saying, ah. Go back to breathing through your nose. Take a gentle swallow, gently swallow, softening, relaxing your neck and throat muscles. And as your inhale flows into your exhale, and your exhale flows into your inhale, your jaw releases all that stuff you've been chewing and storing in the back of your jaw all day today, all week, all month, all year. Sigh. And allow your jaw to soften again. Your facial muscles relax. And your mind just softens. The muscles in your scalp relax, releasing the tension that we can hold in our scalp from trying to think, looking at our devices all day. Just let that go. And as you deepen your inhalations easily, feel the scrumptiousness of your breath. Feel the scrumptiousness of your inhale and your exhale loving on your heart, in your heart, through your heart. Feel the scrumptiousness of your breath, your inhale, your exhale, softening, relaxing your mind. Open your mouth gently, take a breath in. Exhale, saying, ah. Go back to breathing through your nose. And allow yourself, when it's cold outside and we're in our bed and we're under the covers, and you know how you just snuggle? You get into that one good spot and you snuggle into the covers, snuggle into your breath a little deeper. Allow your breath to take you deeper into relaxation, deeper into that space within you that never leaves you, that space, that place of pure peace, of courage, of clarity, of love. Allow the scrumptiousness of your breath to take you deeper. Deepen your inhalations just a little bit more with no effort. And now open your mouth again and sweetly take a breath in. And with tenderness, exhale. Let's do that again. Open your mouth. Inhale the scrumptiousness of all there is. And exhale, giving to yourself deliciousness. Exhale. Beautiful. When you complete that exhalation, go back to breathing through your nose. Your inhale flows into your exhale. Your exhale flows into your inhale. And again, feel the deliciousness of your breath just going into the nucleus of every cell of your heart. In your mind's eye, see your breath encapsulate lovingly your heart. Feel the pure love of your breath in, around and through your heart. Beautiful. Take a nice deep breath in of that. Exhale, saying, ah. Let's do that again because it sounded good. Inhale. Exhale, juicy. Ah, yeah, give me a little more juice there. Open your mouth wider, take a breath in. Juicy, sweet exhale. There you go. Now, if there's anything you'd like to release, open your mouth, inhale. As you exhale, let it go. Beautiful. One more time. Open your mouth, inhale. Exhale and let it go. Now take a scrumptious inhale through a wide open mouth, taking in all of the scrumptiousness of your breath and all there is. And exhale that scrumptiousness into your body. Beautiful. Gently take your fingertips, brush your heart. Brush your heart. Gently shake your hands out. Gently, gently, gently. Let your hands rest by your side. Wiggle your fingers. Wiggle your toes. And take the fingertips of your left and right hand and sweetly touch your cheeks. Sweetly, sweetly. Like you're touching a newborn baby. There's a speaker coming up who I had the pleasure of standing next to and feeling the energy of her soon-to-come baby, like you're touching that little one's face. Open your mouth, take a breath in. Sweetly exhale. Wiggle your fingers. Wiggle your toes. With love for yourself, open your eyes. And just very gently begin to sway in your chair, just gently. And begin to scoot a little bit more closer to the front of your seat. Your booty, move your booty a little forward. Roll your shoulders. And if you can, stand up. Come on now. Stand up. And all this energy we just created, come on now, let's get it moving. Move those hips. I see you over there. Wave your hands up in the air, really move the energy. Move your feet up and down. Roll your shoulders back. Come on now. Give the boutoir a little wiggle. Shimmy the shoulders. Roll the shoulders back again. And feel the deliciousness of your breath. How good it is to be alive. Come on now. Shake your hands out. And have a seat. Thank you. I have to tell you, I love that jam. I'm really impressed with myself that I didn't start, dancing off the stage. I just want to share with you a couple of things. When things get funky, and they will, because it's life, gently stroke your cheek as if you're touching a baby. Now, someone may say to you, oh, for heaven's sakes, what in the world is that person doing? Just tell them, you sit over there, I'm handling myself. It will soothe you, it will relax you, it will bring your heart rate down. The other thing to do is, if you're in a situation with someone who's being unkind, you can just do this. They may think, well, you're moving, well, not me moving my hair, but, they may just think that you're just brushing something off of your shoulders to just get yourself to relax, and you'll notice that your breath will increase. When I say increase, it will deepen, and you will relax, and the heart rate will come down. The other thing that you can do, these are energy medicine tips I'm sharing with you, is just take your fingertips and just gently brush your sternum. These will bring you right into this present moment, whatever that present moment is bringing forward to you. Okay? Let me show you one more. Take your middle finger. There's a little dimple behind your earlobe. Get both of them. Allow the palm of your hand to rest on your jaw. You are activating your parasympathetic nervous system. You will relax. Your vagus nerve begins up here. And my time is complete, but I'm going to get this in. What you're going to do is just feel super duper relaxed and present in the moment for whatever that moment is offering you at that time. And if no one has told you today, let me be the first to say to you, I love you. Thank you so much. I honor you being here. And I didn't even say thank you, TPA, for inviting me. Thank you.
Wow, right? Is the energy up? She found a way to get you relaxed, but also alive, right? So thank you so much, Kathleen, for that peaceful and enlightening presentation. It is my distinct pleasure to introduce our third speaker, Jen Rosenbaum. Jen Rosenbaum is a portrait photographer and author, a breast cancer survivor and advocate, and the host of the Life After Breast Cancer podcast. Since 2008, she has found a burgeoning audience in the intimate photography market and is now sharing her shamelessly feminine movement with women worldwide. Through her work, Jen is helping women celebrate their unique femininity and helping breast cancer patients and survivors put their lives back together after cancer. By daring her clients to shed their clothes, they begin to shed their inhibitions. I have sat for Jen, and the experience is magic, I can tell you. She proves that you can own your own world if you live fearlessly, think audaciously, and act spontaneously. With us tonight to present Healing Power of Photography, please welcome Jen Rosenbaum.
Thank you, Poppy Booty. Hi, guys. That's a hard act to follow, I have to say. That was amazing. Okay, I need to take out my notes. So it's funny that Trish said that she sat for me before, because I was thinking to myself, I'm a little nervous tonight. This is the first time I'm giving this particular talk. So, you always hear people say, well, just picture the audience in their underwear. And actually looking out tonight, I see between Trish and a few others out there, I've seen most of you in your underwear. So we've already done that. I'm here today to talk to you about the healing power of photography, to share my journey and how I use photography, and to help me and countless others reconnect with our bodies, normalize breast cancer experiences, and find beauty in the struggle of breast cancer. When you look at this, it's a camera, right? That's what you see, a camera. But for me, I see so much more. My camera actually saved my life, in more ways than one, to be honest. My camera found my cancer, believe it or not. I know Dr. Port was talking about mammograms and sonograms and self-detection in all the different ways, and those are all really important. But sometimes you really just need to be able to observe your own body and really be in touch with what's going on. One day in the mirror, I took a selfie, as we all do all the time, right? And I noticed a little something on my chest, something I hadn't seen before. It was just a small shadow, something maybe the rest of the world wouldn't even notice. But as a photographer, I was looking at the light. I wanted to see all the details of my image. And I thought to myself, what is that? And I started feeling around. And sure enough, 3 weeks later, in July 2017, on this day, I had bilateral mastectomy. I was diagnosed with invasive lobular carcinoma that, again, I found through my camera. And it was a no-brainer. Mastectomy was the way to go. So this was the day that I went in for my mastectomy. I wore a camouflage shirt because I was ready to fight, and I wore my pink Manolos because, breast cancer is an attack on the femininity, so we have to bring it in back kind of any way that we can. So I decided I was going to wear my pink Manolos right into the operating room. I didn't really care. And the nurses said, this is the first time I've ever seen anybody wear pink high heels to their mastectomy. And I was like, really? We need to start that trend. So my camera didn't only save my life, it gave me perspective. Perspective is an amazing gift that we get from cancer and all of the things that go along with it. When I had my mastectomy, the day of, the night of, because it was a very long surgery, a doctor came in to check on me. We opened up my mastectomy bra, took off all of the bandages, and she was looking at it and she said, "It looks good." And I handed her my phone. I said, "Can you take a picture, please?" Because this is how I operate in life. I take pictures of everything. And she said, "Are you sure you want me to take a picture?" I said, "I really do. If I choose to look at it, that's my choice, but I want to at least have it so I can remember." You know, when we take pictures of things, it helps jog our memories. It makes our memories stronger. And I wanted to remember all of the experiences, good and bad, because I knew that they were going to cultivate a new me. So I wanted to remember them. This was the picture that she took. So of course I immediately looked at it. I was totally lying. Of course I was going to look at it. How do you not want to see what you look like after you have your breasts removed? She looked at me really nervous. She said, "What do you think?" And I said, "I think it's totally badass." And she's like, "I never heard that reaction before." But it really was. I knew in that moment, as horrendous as it looks, I survived. I survived this day. I survived getting here right now. I survived telling my breast cancer to get out of my body. I survived that. And I knew that anytime I had to do anything difficult in my life, all I had to do was look down, see my scars, and remember that I could do anything. So for me, it was a very powerful moment. My camera also gave me courage. Shortly after I had my surgeries, I was doing a lot of writing, a lot of Instagram posts and Facebook videos, and I was being contacted to write for certain online magazines and blogs, and I was very nervous about showing any pictures of my chest. But honestly, my camera really gave me courage to start documenting my own journey, just as I had been documenting women's journeys throughout all of my years as a photographer. You know, people say, "Oh, you're an intimate photographer or a boudoir photographer, it's sexy or it's pornographic," or whatever words people want to use. But the truth is, it's really empowering. It helps women connect with their bodies, connect with who they are. It gives women a free space to just be themselves. No apologies necessary. So I decided I was going to do the same for myself. I knew if my camera was healing people for so many years, maybe it could heal me too. So I started taking pictures and putting them out in the world. Also because I had no idea what breast cancer looked like. I mean, sure, I did the whole Googling the before and after pictures of mastectomies and reconstruction, and it was really quite frightening what I saw, right? The medical pictures against the blue backdrop, and every woman is standing there like this, right? Nobody's happy to be there. So I shared some images of myself. And then I got really brave. And I started really documenting every surgery that I had. I've had 4 reconstruction surgeries. Documenting everything. I wanted to see what a drain looked like. I wanted to show the world. I didn't know what a drain looked like. My doctor said, "Oh, you're going to have drains." I'm like, "What's a drain?" I have no medical background. I had no idea. When they said you're going to be bruised on your thighs from a little fat grafting, I didn't realize that they meant there was actually going to be a Rorschach test on my body after I was done. But it was important for me to show images like this. It was important for me to shock people a little bit. Yes, my hair is done, and I have red lipstick on, and I'm smiling, and I'm home, and I'm happy, and underneath all of my clothes, this is what I look like. You wouldn't know if I went out in public that this is what was going on underneath. And my camera gave me connection. When I was undergoing chemotherapy, I decided that on the weeks that I wasn't having chemo, I was still going to work. I was still going to photograph women and travel and speak and do all of the things that made me happy. Life was too short to sit around and just give into it. So I reached out to a woman named Marianne, and so many people told me about her, how strong she was, how amazing she was. So we became friendly. And I asked her if I could photograph her. So I'm going to show you a video of my experience with her and how my camera really gave me connection. I'll tell you a brief story after. And you will see here, this is when I'm actually undergoing chemo. So you'll get a little idea of what's going on.
I had implants, and the implants got infected. So I had 5 infections, and I kind of was like, I didn't want any more. So I had to have them removed. It was a matter of getting sicker. This is not what I chose, it chose me, and I often say that. But the other women that I have met that are also flat, they chose it, and they're very happy and very comfortable. I'm just the type of person just trying to find themselves in this new body. Not having these breasts that you've had all your life, you have to find a new body image. And I found it here. This is my beautiful sexy. And it's not breasts, it's just, this is my skin, and my scars are my journey. My name is Marianne, and I'm very proud to be a breast cancer survivor. The advice I'd give to people who are going through breast cancer is, yes, you're gonna have new breasts. And yes, your body image is gonna completely change. But it makes you think about what is sexy, what is beautiful within you. It's so in you. And you'll discover it in small little ways, but you'll discover it. I met Jen online. I found out about her blog, her breast cancer blog, and that's how I found out. And then I discovered that she was a photographer. Didn't know anything much more about her than her blog, and I heard a lot about her blog from different people. And I was interested in her photography, and then she wanted to take pictures of me. And I was really happy because this is a subject that's very personal to me and obviously personal to her as well. And I've been photographed before showing my scars, and this was a different opportunity to show my other side, and that's what I got to do. It was just an experience that I didn't expect, and I hadn't ever had the makeup put on and the hair done and wear something that was not typical of what I would normally wear. This is, and putting on an attitude that I didn't expect to have, and it was an experience that is very, very unique and important. Being photographed has really helped me embrace my new body. It's not only just you see it, it's visual, you're also sharing it, and then the empowerment that happens. Emotional.
I'm happy I found you.
Thank you. When Marianne left that day, she's here today, sorry to embarrass you, Marianne, but I don't know if she knows the story, but when she left that day, I remember turning to my makeup artist and hairdresser, who are good friends of mine, and I just said, my God, isn't she amazing? I mean, don't you feel inspired to live life? Don't you feel like, I want to be like that. I want to be strong, and I want to be empowering, and I want to be just amazing like her. And I remember my hairdresser, Diana, looking at me and kind of cocking her head to the side, and she goes, what do you mean? You are like that. That's how we see you. I was like, whoa, really? that's kind of cool. What I learned from photographing Marianne when I was in that time where I'm having chemo and I'm really struggling and I can't see myself was that people see you in a different way than you see yourself. And when I'm photographing other patients and survivors, it is allowing me to be a mirror to them and them a mirror to me. For us to exchange this energy of empowerment is so incredibly special. Thank you, Marianne, this is years ago, but I'm so grateful for that experience. It was really amazing. I only have 1 minute, so we're gonna talk fast. Ready? My camera also gave me community. So as you know, as much as we have so much support around us, and we have loving family and friends if you're lucky, and you know, siblings, and everybody around you is telling you that they love you and they support you, nobody really understands you like another breast cancer patient or survivor or thriver. So I was given the gift of a beautiful breast cancer community. And what I started realizing while I'm photographing other women was that they also have these beautifully complex stories to tell. There's so many different things that we see, so many different phases of the journey, and I really wanted to spend time normalizing the breast cancer body. This woman is pregnant. So for me, it was really about showing women in all different ways, sensually, beautifully, feminine, pre-vivors. And my camera gave me hope. There was a period of time, for sure, I did not have hope. I was very in my mind, in my space of breast cancer. So I decided to start doing some self-portraits, a self-portrait, more of an artistic series, where I was inspired by kintsugi, which is the Japanese art of putting things back together with gold gilding. So I started doing some self-portrait work. And then other survivors from the community, sorry, we're not allowed to show nipples for some reason here, but I had to do a little editing. But I started painting other survivors, in painting them, telling their stories and showing their unique journey through the painting and then photographing them. And each painting really represents something that is part of their journey. I still have sand all over my studio. That was a year ago. It's well worth it. This was a great painting that we did. What we did was I had outlined the lotus on her, and then we wrote all these different words in the lotus that she wanted to get rid of, things like fear and all these negative terms that she was struggling with, anxiety, whatever it might be, and then we painted over it and created something beautiful so we could say goodbye to all of those fearful words. My time is up, so I just want to tell you that I hope next time you see a camera, you'll understand that cameras give many gifts. It is such an honor to be able to capture my own journey and capture other people's journeys, helping inspire people and helping them get through this crazy world that we know of breast cancer. And I'm especially grateful to my camera for gifting me a future. Thank you guys so much.
Please welcome to the stage TPA President Nicole Seagriff and Vice President Samantha Golkin-Nigliazzo.
Thank you. And a big thank you to Jen for sharing her journey and her really powerful photography. I'm Nicole Seagriff, and I'm here with Samantha Golkin-Nigliazzo. We are co-chairs of tonight's event and serve as President and Vice President of the Pink Agenda's Board of Directors. We are both also breast cancer survivors. Breast cancer is the leading cause of cancer death in women under 40, and 5% of women diagnosed this year will be under 40. And when these women, like Sam, myself, many of you in the audience, are diagnosed, it's often with a breast cancer more aggressive and less responsive to hormone therapy. At the Pink Agenda and the Breast Cancer Research Foundation, we are on a mission to find a cure. And thanks to contributions like those made by you tonight, that dream is closer to becoming a reality. When caught early, the 5-year relative survival rate for women with localized breast cancer is 99%, and the average relative survival rate for women diagnosed with breast cancer is 91%. We believe that knowledge is power, and I joined the Pink Agenda 10 years ago to contribute to its mission to raise awareness about breast cancer among my peers. But breast cancer continues to be the most commonly diagnosed cancer in the world, with nearly 300,000 new cases in women in the United States alone this year. And so it's clear our work is not yet done. More alarmingly, within our community, there was a 32% increase in metastatic breast cancer diagnoses in women ages 25 to 39 between 2009 and 2015. And so the Pink Agenda approaches these major challenges from 2 angles: through the research that we fund and through the educational programming like our event tonight, designed to connect with people in this age group. As we just heard from Dr. Port, researchers and oncologists dedicate countless hours to studies that advance groundbreaking therapies and revolutionize the standard of care. Through our valued partnership with the Breast Cancer Research Foundation, we are so proud to fund the work of 4 world-class scientists this year. Because of your support, these researchers have the capacity to recruit more participants for clinical studies that aim to improve survivorship and quality of life after a diagnosis. They have more time in the lab to investigate risk factors for developing breast cancer and tools to develop more preventative strategies. They will be able to test more innovative ways to harness the body's immune system to stop metastasis, which is the fatal spread of breast cancer to other parts of the body.
Tonight, we ask you to join us in moving life-saving and life-changing research forward, like the work done by Drs. Port and Irwin, who you'll hear from later, so that one day all people diagnosed with breast cancer have a 100% chance of survival. This is your turn to make a change now, and so and for not only us, but for the next generation. And I ask you to please take out your phones to show your support of the Pink Agenda. The amount that you can donate tonight correlates directly with the research time that the Pink Agenda funds. $50 equals 1 hour of research, $500 funds 1 day of research, and $2,500 funds 1 week of breast cancer research. And by following a few simple steps, you can contribute to our mission to making breast cancer history. At any time tonight, on your cell phones, you can create a new text and text the phrase TPA Talks, no spaces, to the number 44321. As you can see there, again, 44321, to receive a secure link and donate. And these easy to follow instructions are also in your program booklet. So your generous gift would not be billed to your mobile carrier, but rather we will be sending a secure link that will lead you through the payment process. Now, who's going to be the first to text in their pledge to the Pink Agenda? And a very, very big thank you to all the donors so far. Aaron, Sarah, thank you very much. Look at that screen, see all, oh wow.
People are fast.
Yes, thank you everybody. These gifts are so meaningful. You can see right here, you're funding hours and hours of research that really make such a difference, and we do very much appreciate it. It all goes a long way. And so we are about to take a 15-minute intermission, but during this intermission and all night long, you'll be able to donate, again, text TPA Talks to 44321, and you'll receive your security. So thank you to everybody so far. This is amazing. You can see hours and hours right on that screen. So we very much appreciate it. And we'll see you in 15 minutes.
Thank you.
Thank you.
Welcome back to TPA Talks. Unfortunately, my dear friend and colleague and fellow breast cancer survivor, Bianca Muniz, is unable to be with us this evening. So to kick off our second half of the program, I am honored to introduce Dr. Melinda Irwin as tonight's next TPA Talk speaker. Dr. Irwin is the Susan Dwight Bliss Professor of Epidemiology and Associate Dean for Research at the Yale School of Public Health and the Director of the Yale Cancer Center. Dr. Irwin's BCRF-funded research is focused on understanding how lifestyle factors such as weight and exercise impact the risk of breast cancer and outcomes of breast cancer treatment. She and her team continue to examine the effects of diet and physical activity interventions on endocrine therapy adherence and patient-reported outcomes, biomarkers, and body composition parameters. Here to present exercise as adjuvant therapy in breast cancer care, Dr. Melinda Irwin.
Good evening, everyone. I'm delighted to be here. Thank you for inviting me to share with you why I think exercise is adjuvant care, adjuvant treatment for breast cancer care. So as you might know, you've heard the term adjuvant chemotherapy or neoadjuvant chemotherapy, meaning before or after surgery. I'm going to share with you the evidence to date as to why exercise should be considered adjuvant therapy for breast cancer care. But first, a little bit about myself. So I've always thought exercise is quite important. I started gymnastics at the age of 5 and competed at the national level through college at the Division I level. I always thought I'd be an orthopedist given I had 2 knee surgeries, stress fracture in the back, and a number of other injuries. But then shortly in the middle of my high school years, my mother was diagnosed with metastatic breast cancer in the fall of 1986. I was 16 and she was 45 years old. The picture on the right is the week that she was diagnosed with breast cancer. And this really, struck a chord with me. It was different in the 80s, breast cancer. No one really talked about any cancer, didn't talk about it with your neighbors or your friends, and the treatments were very different then, not as advanced as today. And so it was at that time I thought, I'm going to pivot away from talking about an interest in orthopedics and more focused on breast cancer prevention and treatment. And in fact, around that time, when we look at her passing in 1989 from breast cancer, we see that this was the peak of mortality from breast cancer in the year 1989. But what we have to celebrate now is a 40% reduction in breast cancer mortality rates from that peak in 1989. Much of this because of advances in cancer screening and cancer treatment. So much to be celebrated, but interestingly, during these past 3 decades, at the same time that we're seeing reductions in breast cancer mortality rates, we're seeing adverse changes in physical activity and sedentary behavior. So you see in the blue line is a decrease in physical activity levels over the last 3 decades, and the red line is the increase in sedentary behavior. And much of this is because of technological advances, the computer, iPads, iPhones, social media, and whatnot, making us more sedentary. And now Zoom and the ability to work from the comforts of our home. So in turn, this is making us quite sedentary. So what does that mean for breast cancer prevention and prognosis? So right around the time my mom was diagnosed with breast cancer, in 1985 was the very first publication looking at the association between physical activity and breast cancer on the left here. This was a very crude analysis looking at college athletes on the bottom there in the dotted line compared to non-college athletes, and showing that the prevalence of breast cancer was higher in non-college athletes. A very crude analysis, and it wasn't until 1994 Leslie Bernstein published the first methodologically strong analysis really looking at physical activity levels in the premenopausal years and reduced risk of breast cancer, showing that 1 to 4 hours per week of exercise was associated with up to about a 50% lower risk of developing breast cancer. This was right when I was starting my PhD. I was fortunate to work with Leslie Bernstein in the late 90s and be mentored by her. What about mortality? So we see here on the, see on the left here, this is a meta-analysis, which is basically pooling a lot of observational studies, and there's been over 100 studies looking at higher physical activity levels, lower mortality after diagnosis of cancer. And you can see from the figure that going from no physical activity to just some is associated with a benefit. And then on the right, just recently last year, an analysis looking at the amount of steps we do. The more steps, the lower risk of mortality, with about 5,000 steps a day where we see the most benefit. And so these observational findings are really intriguing as to, well, what are the mechanisms mediating these observed associations between physical activity and incidence in mortality? And we know there are 3 main mechanisms: inflammation, insulin resistance, and hormones, sex steroids, estrogens, and androgens. So what we can do is we can then design trials where we have people increase their exercise level, and we can collect a blood sample at the baseline of the intervention and at the end of the intervention to see if these biomarkers, blood-based biomarkers, change with exercise. And in fact, much of that work, seminal work done in the late 90s, was led by Ann McTiernan, who I was also really lucky to work with and be mentored by her. And if you look in the middle column there, exercise, you see a negative sign with all of these blood-based biomarkers. So a brisk walking program associated with reductions in CRP as a marker of inflammation, insulin, and other markers. And that exercise plus diet-induced weight loss is associated with even a greater benefit, upwards of about 40% decrease in a marker of inflammation, CRP. So I was really intrigued with these findings, and when I arrived at Yale in 2001, about 20 years ago, I was curious as to, well, what happens after a diagnosis of breast cancer? Does it matter if we increase our exercise levels, and are the mechanisms similar? And the reason it was important to ask this question is because We know that chemotherapy, if you look on the right, this is a group that had chemotherapy versus on the left, a group that did not have chemotherapy. This was the first paper published in 2001 showing that chemotherapy causes an increase in adiposity and a decrease in muscle mass. And Wendy DeMarc-Wanfried, who published this, coined this as sarcopenic obesity, where your weight might stay the same, but you actually have an increased adiposity and loss of muscle mass with chemotherapy. We also know more recently from colleagues, Betty Kahn and others out at, from the Kaiser Permanente, that sarcopenia, which is low muscle mass and low muscle function together, are associated with worse breast cancer mortality. And this is measured at diagnosis. So if you have a low muscle mass at diagnosis, that's adversely related to mortality. So that then begs the question, how can we maintain our muscle during chemotherapy or increase it to further improve our prognosis? So the research that I've done, as well as others have done, is to look at how to also improve toxicity associated with treatment, chemotherapy and endocrine therapy. On the left here, we did a trial showing that exercise among women taking aromatase inhibitors for breast cancer have a very common side effect called arthralgia or joint pain. And we did an exercise trial showing that exercise was associated with a 30% reduction in joint pain or arthralgia. And on the right, we did a trial just recently finding that an exercise intervention reduced peripheral neuropathy, which is a very common side effect of chemotherapy. And these were interventions that primarily involved just brisk walking most days of the week. We also looked at these blood-based biomarkers in women who had completed treatment for breast cancer, showing that the exercise intervention led to about a 30% decrease in C-reactive protein, which is this marker of inflammation, and favorable changes in insulin and leptin. And very recently, just this past year, a very provocative finding, we completed a trial of women receiving neoadjuvant chemotherapy before their surgery, and we randomized them to an exercise and nutrition intervention or to usual care, with both groups receiving neoadjuvant chemotherapy. And at the end of their chemo, right before their surgery, there's often a measure of prognosis called the pathologic complete response, or PathCR, or PCR. And it's defined as the disappearance of all invasive cancer in the breast after completing neoadjuvant. And in our exercise intervention, we found that 53% of these women had a PathCR. That means no evidence of disease remaining in their breasts, compared to 28% in the usual care group, the neoadjuvant group not receiving the exercise intervention. So very provocative findings that exercise can have a direct effect on the tumor response. We also interview the women at the end of completing these interventions. And many of the women, when we present to them the study, they've just been diagnosed with breast cancer. They're going to be receiving chemotherapy, and we tell them about our exercise and nutrition interventions. And these are just 3 takeaways from women that participated in the trial. I'm physically stronger now than before my diagnosis, so stronger at the end of chemotherapy than before. It never occurred to me to be active and pay attention to eating habits during treatment. And I wasn't sure what to expect, but when I started the study, I know it was life-saving to me. And this picture on the right is a woman who was enrolled in our trial, and at the beginning of chemo, she said her goal was, after her last treatment, to be able to do a handstand on the beach with her family. She was herself also a gymnast in her early years, and here she is doing a handstand on the beach with her family. So I hope I've convinced you of the evidence that exercise is adjuvant therapy, and that it increases muscle mass and reduces body fat, reduces treatment toxicity, improves treatment response, improves quality of life, and is associated with better survival. And I'd just like to acknowledge all the study participants who've participated in my trials, and the team I'm so fortunate to work with at Yale and beyond. Thank you.
Thank you, Dr. Irwin. What an interesting and informative presentation. Our final presenter, Beth Nicely, is a former Radio City Rockette, Broadway performer, and business owner. Beth is an NASM certified personal trainer with certified postnatal fitness and corrective exercise specializations. In 2020, she launched her own fitness company, The Limit, a dance, HIIT, and tone workout that incorporates functional training to ensure clients of all levels are building strength. Just last year, Beth developed the Breast Cancer Post-Mastectomy Recovery Series due to a gap she recognized in the post-op physical recovery and support options available. Beth provides the series for free to breast cancer survivors on her fitness platform, The Limit On Demand. Here to present recovery and strengthening plan for post-mastectomy and to give us the old razzle-dazzle and get us moving, Beth Nicely.
So, thank you. Hi, everyone. It's nice to see you all. Thank you so much for having me, TPA. Like she said, I've been a trainer here in New York City for 12 years, and I've worked on Broadway, and I was a Radio City Rockette. I've been in 6 Broadway shows. My entire career has been physical activity. So it was just par for the course for me to add on training into my career, and now it's been a full transition where I've created an entire company that started online during the pandemic and has now expanded to a studio location here in New York. I'm a certified trainer through the National Association of Sports Medicine, and I also have special certifications in corrective exercise and pre and postnatal, and I'm also 5 months pregnant, which has been very helpful to me as well. So I love making everyone feel stronger than they think they are, and I love showing everyone how capable they are physically and mentally through my training. And I work with a lot of different levels, a lot of different journeys people have been through, medical issues, injuries, surgeries, and every time I work with someone and I work with a new situation that someone's going through, I do so much research online. So the first time I worked with someone who had a double mastectomy, I just started researching. My corrective exercise specialization helps me with that. My training helps me with that. To personally train someone who has gone through a mastectomy. And when I was doing my research, there was nothing. There was no real guidance on feeling safe and comfortable going back to everyday activities or working out after going through a mastectomy. And I wanted to fill that gap. And I've filled it with people I've personally trained, but I wanted to fill it on a bigger level. And I had created an entire on-demand platform through my company, and I just thought that that was like the perfect way to give access to that. So I developed a 12-week post-mastectomy recovery series. Online, there's information 6 weeks, up to 6 weeks for mobility exercises. You kind of have to dig on YouTube. You find little things that are recommendations, but I wanted a real plan for people. I'm really big about plans, and I think that helps people have just more strength when going into something like a mastectomy surgery, to have a plan after. And testimonials that I've gotten now that I launched it this past November, so people have done it, and people all over the world have done it, and I'm gonna read you some of their testimonials that I've gotten that are amazing. But when you have a plan, especially I'm a trainer, a training plan to get stronger in different aspects, like mentally and physically, it just gives you a support and gives you confidence. And so I was so excited in this recovery series to work with my physical therapist, Dr. Danny Luna. She specializes actually in breast cancer patients, male and female. And so she and I collaborated. It was like the perfect collaboration, and created this series to safely get anyone of all levels, whether you worked out before or were extremely physically active before going through a mastectomy surgery. And then I had 4 amazing guests on the series that all are breast cancer survivors and double mastectomy patients, and I wanted everyone to see themselves doing the exercises, because I think it's very important to see someone going through what you've been through doing these exercises, let alone myself and my physical therapist, who are both certified and knowledgeable. It's really helpful to see other people's journeys. And then I also have my wonderful friend, Margot Grunberg, who is on the council here at the Pink Agenda in the series as well. Her mother unfortunately passed away from breast cancer, so she was one of my special guests on the series to support this wonderful community. And so, all in all, basically, I want to take everyone through a wonderful mobility exercise today. And I think it'll actually leave everyone feeling really good and kind of open. I found that this, in everyday life, we're like this all the time, but I found this is very common, a very protective posture when you've had a mastectomy. And so we want to open the pecs and engage your upper posterior chain. So I have my chair here, we're all seated. We're going to sit straight up in our seats, tall spine, lengthening through the spine, and it's great. I'm the person Kathleen was talking about that was pregnant, that she felt that we met. So actually, Kathleen's amazing talk on breathwork is going to go hand in hand with this exercise. You're going to sit up straight. Your elbows are going to press against the back of the chair, and your elbows are going to be at 90 degrees as well. And you don't want to put too much effort into it with your torso. You want to push forward through your upper back arms and open your chest, and then release back. Yeah, you're gonna breathe out. Breathe in through your nose on the way back. And breathe in. Breathe out. And breathe in. Squeezing those shoulder blades together as you come forward. And breathe in, just engaging your upper posterior chain in your upper back. And gently just expanding and stretching those pectoral muscles. And back. Take 4 more. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. 1 more. Breathe out. Now hold here, and we're going to externally rotate our forearms. Open and tension, press close. Open, yes, and press close. Remember to keep breathing on this. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Tall spine, like a string's pulling you up through the top of your head. Ooh, mood lighting. Breathe in. Hey. Breathe out. Breathe in. Take 2 more. Breathe out. Breathe in. Breathe out. Breathe in. Good. Gently drop your arms. Does anyone feel like they're sitting up a little bit straighter? Yeah? That upper back is engaged a little bit. Gentle. Very important. Obviously, right post-surgery. The program starts 3 to 7 days post-surgery. All about mobility, and gently takes you through exercises like this. And range of motion is different for everybody, but it just helps teach your body to not be fearful of a proud chest, yeah? Opening up and breathing. So I want to read you some of these testimonials, which are on my phone over here, to end with. From social media to personal emails that we've received. Gwenie Frank, my surgery was 1 week ago, and I just did the first couple videos, and they were great. Just what I needed to move my body differently and lift my mood. Thank you. Dear Beth and team, I just wanted to reach out to thank you for the post-mastectomy program. It felt like it was made for me. I had a double mastectomy and reconstruction on September 28th, and by luck, or by social media algorithms, I came across your program 2 weeks after my major surgery. I've been following along ever since. I can hold a plank for a minute, which is a big deal, yeah, and reach both arms fully above my head when standing, which in the program we progress to hands going over your shoulders. Overhead when lying down is still a work in progress, totally fine. More importantly, the program has given me confidence to progress through step-by-step rehab. I'm so grateful to you and pretty much proud of myself into the bargain. I'm at week 11 now out of the 12 weeks and a bit nervous of what I'll do with the guidance once I graduate. Anyway, once again, thank you for such a valuable and thoughtful program delivered with compassion and respect. Best wishes, Avalee Weir, Melbourne, Australia. Hi, Beth. I had a breast mastectomy last Thursday. They removed the full breast with sentinel nodes for biopsy. I'm a male, age 53, very active before the surgery, and I started on the 3rd day training with your awesome videos. Now, after 5 days, I can see very low amount of liquid from my drainage and gain a lot of confidence. After just 3 sessions, my range of movements have already increased, as well as my self-confidence. I'm almost free of painkillers. Finding your videos was a blessing. I plan to keep on 12-week course and give you periodic feedback as I am a male recreational runner. Would love to hear from you. Cheers from Buenos Aires. Hello, The Limit Fit. I just want to thank you for offering the breast cancer post-mastectomy series. My diagnosis was a huge hit to me, making me so worried about continuing to be active and athletic. I did many of the videos after surgery, and in addition to helping me regain mobility and not lose too much strength, they also encouraged me in a way I never expected. While the world around me went on, these trainers acknowledged the hard part of just going through mastectomy at the same time challenging me to push through and be strong. I'm so grateful. Please let the trainers know that they have made a big impact in my life during a really tough time. Marlo. So not only does it work, it's a recovery series. It's to help mobility and strength, but it's a support series as well. And I wanted to just put that out there into the world, free to everyone, because as we've talked about, we live in New York City with a lot of access here. And surprisingly, like in Montana, the physical therapy might not be quite available to someone there going through breast cancer and a mastectomy. And to have a physical therapist here in New York, a certified trainer, and other women who have gone through a mastectomy in a 12-week, very laid out program to get you back to doing activities of daily life and working out confidently. I just want to spread that to everyone. So if you want to let everyone know about it, it's free to everyone at thelimitfit.com on our on-demand platform. And it's helped a lot of people so far. So really, really great. And I hope that it helps you or anyone else you know. And thank you for having me this evening.
Please welcome back to the stage TPA President Nicole Seagriff and Vice President Samantha Golkin-Migliazzo.
Wasn't she great?
Well, thank you, Beth. That was so nice to end our night on a movement-focused way. And thank you to all of you for joining the Pink Agenda's annual TPA Talks event. We hope that you leave here not just feeling informed and knowing how to breathe, but also proud to support the Pink Agenda and the work that we're funding. This event was made possible by our sponsors, Jeffrey Golkin Partners and Mazar, and we are incredibly grateful for their generosity. We would also like to thank our lineup of brilliant and inspiring speakers and our wonderful host, Trish, who have all generously donated their time and talents to be with us tonight. Their commitment to the cause is really beyond measure, and we are incredibly grateful. We also want to extend a very special thank you to our friends at the Sheen Center, who year after year provide us with great hospitality, and so a special thank you to Victoria and Joe.
And also, this event would not be possible without the Pink Agenda's Education Committee, who has worked tirelessly to ensure that tonight was a success. So special thanks to Education Committee members Pamela, Cara, Maggie, Melissa, Amanda, Erica, Robin, Tierney, Marla, Natalie, Brittany, Judy, Jonathan, Shayla, and Eleanor. We have a wonderful committee, and we are so proud of the work that they do for us. And a very special thank you to Leadership Council member Kaylee, who joined us on the stage earlier this evening. And as we go with thank yous, another big thank you to our Pink Agenda team, Sarah Ecken and John Kyatt. They work tirelessly for the organization as well, and we could not do this without their support and the support of all the BCRF volunteers. If you'd like to learn more about the Pink Agenda and how to get involved, you can see them in the lobby. And we hope that you will be joining us at our upcoming events, including Pilates for a Purpose with Real Pilates next Saturday, April 22nd, the return of the Pink Agenda's annual Spring Fling, Monday, May 1st at the Maid Hotel rooftop, TPA at the ball game on Tuesday, June 20th, when the New York Yankees take on the Seattle Mariners at Yankee Stadium. And also, be sure to save the date for our annual New York City Gala on Thursday, October 5th at the Tribeca rooftop. And so tonight, we are making a difference for ourselves, for the next generation, and we do hope you enjoy the rest of the evening. Thank you so much for joining us at TPA Talks.
Thank you.
Thank you.